My name is Craig Davidson, and I wanted to take this opportunity to talk to you a little bit about social justice, health and equity, equality, diversity, and inclusion, and why these areas are so important to me. So, just a little backstory. I grew up and started primary school in the early 90s, so the tail end of Thatcher's Britain. So, Section 28 was very much still in force. So, I was really badly bullied at school for being gay. And this was years before I ever came out. And though teachers could address the bullying, they could never discuss that being gay was okay and that there was no problem. So this led to years of internalized homophobia, which I took with me all throughout my 20s into my early 30s and had a hugely detrimental impact to my mental health. And this was prior to me coming into a career in nursing. So I've always been driven by making sure that nobody is made to feel different or that being different is something to be ashamed of. I'm also driven by the fact that we should be aiming for equitable healthcare for all. Because if we do not get healthcare right for minority populations, we do not get it right for anyone. So let's address the elephant in the room. I quite clearly am a white cisgender male. I can't change that. I can acknowledge it. Now, I do identify as being gay, so I do have one of the protected characteristics, but I can't possibly cover them all, and nor would I try to say that I could speak for them all. But what I can do is listen. I can listen to my female colleagues. I can listen to my transgender colleagues and to my colleagues from Black, Asian, and minority ethnic backgrounds. Now, while I have been a student nurse and now as a newly registered nurse, I've held various official and unofficial leadership positions. When I was departmental representative at my university, I was part of our course redesigning our programme as part of the NMC education standards. Now, a big part of that I had noticed throughout my nursing education was that a great deal of our education focused on white populations. They focused on heteronormativity, and that was despite the fact I live in Glasgow, which is a vastly multicultural city. So I wanted to know, why was this the case? So a lot of my nursing values essays focused on this. Also, in my fourth year, when I did my leadership in interprofessional teams project, we had to come up with a service improvement design. Now, as part of that, I took the NHS Rainbow Badge and came up with an idea of how we could implement that in Scotland. Now, little did I know that this was already being implemented in Scotland in the form of the NHS Scotland Rainbow Badge. And because of the work I had done at university, I was invited to sit on this working group. Now, if we talk about challenges you face, I definitely felt imposter syndrome. I was sitting in this working group with people who were the heads of division for equality and diversity and inclusion from across all the different health boards. So I definitely felt like a fish out of water there. But I felt I was able to bring fresh and new perspectives. And in fact, a suggestion I came up with, not alone, but one that was shared by many, was that we included both the trans chevrons and the Black, Asian and minority ethnic chevrons to our flag. So we've evolved from becoming the NH Scotland Rainbow Flag badge to the NH Scotland Pride badge. Another example, I used to be the RCN Students' Committee chair. And while I had that leadership position, I was very driven by equality, diversity and inclusion, and something that I wanted to push forward was this agenda. And we held our student ambassador conference on this, and we got together a panel who shared their lived experience, and we held a mini congress item where people addressed issues on this topic. Now, I think the best way we can look at this is by looking at our circles of concern, our circles of influence and our circles of control. So my circle of concern is health inequity. Now, what could I do to control those? So when I was at university, I very much chose to focus on these topics in my assignments. I then used this influence to join that working group for the NHS Scotland Pride Badge. When I was on the RCN Students' Committee, again, my circle of control was health inequity, and I was able to use that influence to how we led our student programme that year. So it's all about your concern, your control, and then how you can influence it. So regardless of what these are for you, find what your circle of concern is. Find out how you can directly control it, because being a student nurse and being a newly registered nurse is all consuming, and it is very hard to address everything you want to change in the world. But small changes and small steps can make a massive difference. Thank you so much for listening.
Craig's video was very poignant, and his passion for inclusion, diversity and equitable healthcare clearly shone through. But why is this something we need to consider as leaders? Well, we know that diversity and inclusion leads to improved health and greater staff and patient experience of the NHS. The NHS Workforce and Race Equality Standard, published in 2016, highlighted that 41% of Black and minority ethnic staff said that they were being bullied, harassed or abused, compared to 18% of white staff in similar roles. So what does equality and diversity mean? Equality means giving everyone the same choices and opportunities. We should also treat everyone with equal respect. But equality doesn't mean that we treat everyone in exactly the same way, because we are all different and we all have different needs. Diversity describes the things that make us all different and unique, such as our gender or our cultural background. We don't have patients who all fit the same cookie cutter, and these differences shouldn't affect how we care for someone. An inclusive environment will ensure that people will thrive. Who is responsible for inclusion? Well, it's everyone's responsibility, and all of our everyday behaviours should create a more inclusive environment. We all have biases, but it's what we do about it that's important. We need to read and learn to change things. Especially as a leader, you should be aware of your potential to influence others through your own inclusive, supportive and respectful behaviour to ensure that this is the norm. And how can we become an inclusive leader? Well, we can do this by demonstrating an authentic commitment to diversity, challenging the status quo, holding others accountable, and making inclusion a personal priority. It's important that we reflect on our own personal blind spots, as well as the flaws in the system. Developing an open mindset and being deeply curious about others, listening without judgment and being empathetic to those around us are also key factors. Inclusive leaders are also attentive to other people's cultures and will collaborate with others, empowering them and paying attention to diversity of thinking and psychological safety. Often nursing students state, "I am just a student nurse," as if we are at the bottom of the food chain and have very little control or influence to make a real difference. But as Craig demonstrated, we can take small steps and make small changes as nursing students, which can make a massive difference. Nobody should be made to feel different, but importantly, being different shouldn't be shameful.